A lot of husbands feel very guilty when the wife is going through an IVF treatment cycle, especially when the reason for the IVF is a male factor infertility problem, because they feel that it's my wife who has to take all the injections, she has to go for the scans, she has to spend time in the clinic, she has to take all the shots, the blood tests, she has to go through the anesthesia and the egg retrieval procedure, and they want to know what they can do to support her. Now, the good news is there's a lot you can do. But the bad news is that a lot of husbands don't do any of the supporting properly at all. Remember one thing, you can't take away your wife's pain. She's the one who has to go through the procedure herself. But the most important thing you can do as a partner is emotionally support her. And the best way to emotionally support her is A, to do your homework, to understand logically what's involved in an IVF process, how much is in the patient's control, how much is in the doctor's control, and how much is in God's hands. And then to tell her that you love her and will support her during the journey, no matter what the outcome. Because the reality is the outcome is not in anyone's hands, but the process itself should be a happy and a positive one. And the best way to make this happy and positive is by being well informed and by telling her that you will support her no matter what her decision is. Please don't be clueless. Please don't outsource everything to her. Please don't take a hands off approach and say, fine, you're the patient, you should know what's happening. Or please don't tell her things like, why don't you let the doctor make all the decisions? Or please don't behave like a half doctor by spending all your time on Google. That's actually terrible advice. Accept the fact that she's worried, she's uncertain, she doesn't know what's going to happen, and that the best way to help her is by helping her reduce her uncertainty, by helping her to find the right information, and by helping her to find the right doctor. But also remember one thing, she needs to own the decisions. Your job as a husband is in a supporting actor role. You're not going to be the main star because she's the one who has to make the decisions, because she's the one who has to go through the treatment and carry the pregnancy. So please be supportive, allow her to make her decisions, and tell her you're always available for her. This, I think, is the most important thing which you can do to support her during her journey.